I wanted to go over the top practice builders, and obviously this is a portion of our manual. So over the years, I've tried to collect everything that I felt was super important as far as what we've got from patient feedback and just observing successful doctors and what they're doing to create busy offices, to create amazing patient experiences, and to really get their practices where they are successful. So every time I go back to this list, I try to see if there's anything else, and this is probably version 20 of this list. But these always are the things that I try to revisit myself and try to improve almost daily to make my practice a success. So obviously the first thing is to be super nice to people. Now, a lot of times you might have been around dentists who don't have an attitude of wanting to see new patients, and maybe their dialogue behind the patient's back isn't super positive about patients. That attitude bleeds to your staff, and the whole office has that type of an attitude of not loving patients. And so when you think about your posture towards staff and towards patients, you need to really consider that every patient that walks in your door is the reason that you're there, is the reason that you have staff, is the reason that you can pay your bills. And so just going above and beyond in every sense of the word in trying to make that patient happy and being super nice to that patient really goes a long way. The old adage of people don't care as much about what you know as much as they care about how much you care really is true. I think this also goes into postoperative calls. Patients really appreciate you going out and giving them a call at the end of your clinic day to see how they're doing. Checking in with patients during the procedure to make sure that you have empathy towards them and that you want to make sure that they are as comfortable as possible. We like to send flowers to families who might have lost a loved one that is either one of our patients or maybe just the family member is a patient. A lot of times we'll maybe send a thank you note or some other kind of a personal message to the patient when something is happening in their life. So just going above and beyond and being super nice to patients and people in general is super important. The attitude towards new patients also needs to be, we will see anyone at any time. When I start a denture, I always say, listen, we will work our fingers to the bone to make sure that you get exactly what you want here. It just puts people at ease knowing that we're going to try as hard as we can. So number one thing is being super nice to people. That's your patients, that's your staff, that's basically anyone in your community. The next item is being super organized in all facets of your practice. Running a tight ship, making everyone do their sign-off sheets, and creating accountability. So there's a book called E-Myth, and a lot of entrepreneurs and small business owners have read this book, and I would encourage you to read it. It basically goes through the experience of someone who went to a hotel and they had this crazy awesome experience, and all of these things kind of happened around him that he didn't expect would happen. And he went to the manager and was like, how did you get this amazing experience to happen? And it basically came down to checkoff lists, accountability, and making sure that they created a culture of everyone will do what is on those checkoff lists or they'll be let go. you are going to be interacting with patients who have a million dentists that they can choose from. And if you're going to make a crazy awesome experience, you need to know what you're supposed to do it consistently, and have accountability in your office. You are also most likely going to work with mostly females in your practice. And females especially do not want to walk into an office that is super unorganized. They eventually will leave. And so you need to just be super on top of making sure that the supply closet looks organized, that your office is clean, that there aren't sticky notes all over the place, that your staff looks the part, that you have a reason behind whatever you're doing, that all of your papers are in the right spot, and that you are actively trying to clean up the office. If there's paint on the wall that is starting to look smudged, that you're cleaning it. Maybe if the bathroom's getting dirty, that you're the first one in there to be willing to clean it up. It's so important to run a tight ship and be organized. Your patients will super feel it. If they walk in and there's a paper bomb of sticky notes on the front desk, your patients are going to look at that and say, I wonder if they're also disorganized in the clinic. So be on top of the way that your practice looks. Another thing that I always check on is I go out and look at Google reviews, and I can see if you're not responding to your Google reviews, I understand that you're probably not doing your doctor checkoff list, which if you don't do your doctor checkoff list, things just fall out of order and just aren't done. Just, kind of a microcosm on the Google reviews. If you don't respond to someone in a timely manner, they're going to forget that they were even at the office. Instead of them getting an alert like 2 minutes after or within 1 day of after they left the review, they're like, wow, these people not only asked for my review, but they responded in a timely manner. Wow, these guys, there's something going on at that office that is super organized. But that goes into every little facet of the checkoff list. If you don't have the water bottles refilled by the next staff change, the first patient on that new staff change, the water's going to run out mid-procedure, and it's going to be a little bit of an uncomfortable situation where you ask your assistant to go underneath the cabinet and refill the water bottles. And do you want to have an accumulation of 1,000 of those little details that takes an amazing patient experience and takes it down to just an average patient experience? So be on top of every single checkoff list and make sure that it's done in a timely fashion, okay? Anesthetic technique. I can't emphasize how much this is important. And newer doctors are usually used to working out of the dental school protocol where every quarter carpule needs to be approved by the attending dentist. And sometimes you feel like, oh, wow, I got away with 3/4 of a carpule and I was able to do that filling. That is the wrong way that you should take anesthetic technique. You need to get patients so profoundly numb that they don't feel anything, and that is really what is going to refer their friends back to you. I can't tell you how many patients are like, listen, Dr. Stott, I come back to you because you were able to get me numb on that extraction and no one else has been able to get me numb. So you need to understand the anatomy on where you need to deliver that anesthetic, and you need to essentially bomb the patient with anesthesia so that they don't feel it. You need to give them anesthesia very well at the IAN, on the long buccal, in the vestibule, on the papilla, and then when it's appropriate on the lingual or on the palatal. The other thing too is there's two parts to this, progressive and profound. If you look in the doctor's manual, you'll notice this portion about progressive anesthesia. And it's a very simple yet profound technique, which is you're going to start by giving the patient, usually with a 30 gauge needle, 1 drop underneath the mucosa. And instead of using the topical anesthetic, which 50% of people love and 50% of people hate, you drop 1 drop of anesthesia underneath the mucosa, you pull out immediately, and then start letting it cook. Then you come back in and you start dropping more anesthesia until you see any reaction by the patient, and then you immediately pull out and you let it cook. Usually by the 3rd time, you're going to not have any reaction by the patient, and then you're going to start getting them profoundly numb. So really, the only alert or any response that you're going to, or any reaction that you're going to see from the patient is that first initial injection to only drop 1 drop under the mucosa. Because as soon as you put more than 1 drop under the mucosa, you're going to get blanching, or you're going to get involvement of stretching the mucosa, or you're going to get the acidic feeling or the cold or the warmth of the anesthetic, where reality is if you drop that 1 drop underneath there, they won't feel it, and then all subsequent anesthesia is comfortable by the patients. And I can't tell you how many patients that have come to me and have said, wow, I love your shots. They're so easy. I wasn't worried about it. And patients will refer all of their friends back if you can give progressive and profound anesthesia. Again, this post-operative calls and text, it's just a part of being super nice to people. When you are growing your practice, you need to be calling every patient who has received anesthesia. Every single one of those patients will love you for the rest of their life, and they will come back because, again, they know how much you care. So don't shortchange the post-operative calls and text to the patients. A lot of times I'll go home and I didn't have time to call the patient, and I'll just get on my phone, log into the communication app, and I'll text the patient really quickly and say, hey, patient, I hope you're doing well. Give me a call if you need anything. I'll try to check in with you tomorrow morning. And those patients text back, and sometimes they have a concern. Sometimes they're just like, thanks for checking in. But those patients really will never go anywhere else if you're doing that, okay? Clinical excellence, then clinical efficiency. We all know that there's 2 portions to practice success, and that is the ability to make friends and solve problems, okay? So you need to try as much as possible to obtain clinical excellence. Every single root canal that you do, you should be super critical of yourself and say, what could I have done better? How could I have gotten a better clinical result here? And go through the manuals, talk with your mentors, watch all of the videos, and practice every tiny little move to make sure that you can get a better clinical result. I always say this, do you think that Michael Jordan just went in there and went to the basketball court and just, started playing basketball? No, he had a strategy on every move that he made, and he had practiced that little move thousands of times. So when you see him making a 3-point shot to win the game, it's not like he's doing that for the first time. He's done that thousands of times from that exact same position on the court, so that it's more just muscle memory versus him having to think through things. So work on your clinical excellence. Eventually, if you're doing terrible dentistry, or even mediocre dentistry, or even just good dentistry, that dentistry will fall apart quicker than if you had done very good to excellent dentistry, which is where you need to be all of the time. very good to excellent, okay? And how do you obtain clinical excellence? Is practice, repetition. And don't get bogged down by your failures. You need to look at yourself critically, saying, I did this wrong. I didn't do this as well as I could have, and get up, walk into the next operatory, and just do better the next time. So again, very good to perfect. If you're only satisfied with perfect and you're not satisfied with very good, you're going to be so stressed out for the rest of your life that you're never going to get enough reps in to be able to get to perfect. I try to get to perfect every single procedure, but guess what? Sometimes I fail and I get to very good. It's not that big of an issue. That's where you need to be, is in the very good to perfect area. Once you are good at clinical excellency, then start working on your clinical efficiency. Like I've said many times, patients, and this isn't coming from Dr. Stott, this is coming from patient feedback, which is patients tolerate you at minute 0, they hate you at minute 60, and they will never come back at minute 90. So you need to work on getting all of your procedures down to about an hour, okay? If that takes you at the very beginning of your career two-stepping every single root canal so that you can get those appointments within an hour, do it, okay? If you can't get a root canal and a crown done within an hour, don't do it. Break it up into 2 procedures. If you can't get 10 fillings done in an hour, don't keep the patient for 2 hours to do 10 fillings. Do 5 and then get them back. But you need to work on compressing those time frames so that you can get a lot of dentistry done within an hour. So, I always say this, and this is in the doctor's manual. Do you want to go to a concert where the musician plays half of the notes wrong? No, you wouldn't pay to go to that musician. But let's say that you go to a concert where the musician plays every single note right, but they play the song at half speed. Again, you wouldn't go back to that musician's concert. You want the musician to play all of those notes correctly and at the correct speed. And that's as important. That's the reason why you need to work on both of those aspects, okay? Confidence, again, super important. I think one of the big positives about open and affordable dental is we have all of the scripts there so that you, until you know what you're doing, you can read or rehearse what you're supposed to say in front of patients until you gain that confidence. Confidence comes from experience, and you need to get your reps in so that you can get the experience to gain that confidence. Until then, you basically need to say what has been said before, and like I said, if you follow a mentor and you say what they say and you do what they do, you will get their same results the next day in clinic. So you need to have a lot of confidence. Offering same-day dentistry to every patient. I can't tell you how often I see doctors get stressed out when they have 3 to 4 patients and then they schedule the patient that's in their operatory for another week to get something done that could be done today. Let's say that they're expecting a root canal to come in the next hour, and so they freak out. And so that patient who's in hygiene who needs a couple of fillings are like, well, let's get you in next week and we'll get those fillings done. Guess what? That root canal doesn't show up, and then that patient who was in hygiene also doesn't show up in the next week. And patients, ask yourself, do you ever go into Target to look around? Do you ever go into a restaurant and not expect to spend money? No. People walk into a dental office expecting to get stuff done and to pay money for it. So just have that attitude that someone who's in your office wants to get everything done that day. And Just as a rule of thumb, don't look at your schedule. Just act the same way every single time, which is, so patient, we have this cavity. Did you want to get it done today? Did you want to get it scheduled? What did you want to do? And if they say, I want to get it done today, or did you have time to do it today? You just say, yes, absolutely. I would love to do it for you today. If you say yes, every single patient, you will get so busy that you won't even know what to do with yourself. And it doesn't matter. Even when you do get busy, those patients understand that you are super popular and you have like 5 things going on. And then it's almost like demand creates demand. So offer same-day dentistry to every single patient every single time. Okay. Concentrating on low-hanging fruit. Okay. There's a section in the GP manual that talks about low-hanging fruit. If you look at this diagram here or this picture, you're going to see that the easiest procedures to do are things that you can do the first day out of dental school. Hygiene, rescheduling, doing sealants, fluoride, exams, x-rays, asking for referrals, walking everything out. Those types of procedures, first of all, are paid at usually 100% by the insurance companies, okay? The other thing is they happen frequently. How often do you need an implant or a bridge? You very rarely need those things. How often do you need a prophy? You need them all the time, twice a year at least, okay? And your life will be so rewarding when you are living in the preventative dentistry space. There's nothing in this low-hanging fruit that can go wrong. How often have you had a call in the middle of the night saying that a sealant has fallen off? Never. It's never happened in the history of dentistry. How many times have you been called in the middle of the night saying that the panoramic x-ray that you took didn't work? It doesn't happen. These things are super easy, very well paid, and happen frequently. So, some people like to live in the world of veneers and full mouth rehab. Guess what? 5 years from now, all of that dentistry is going to turn problematic, and all of those patients are going to call back asking for refunds, adjustments, or wanting to get things fixed. This, not going to happen. So just really look through this low-hanging fruit diagram and live in the space of low-hanging fruit, okay? So another thing, extraction finesse. Practice your extractions. Practice every little hand movement. Make it so that patients are wowed by how quickly you got the extraction done, but most of all, how atraumatic it was for them, okay? This might include sectioning teeth. This might include using the best instruments in your hand to make sure that you can get that tooth out as atraumatically and as easily as possible. Most of our patients come in through an emergency, and they're making a huge judgment on your ability to get them out of pain quickly and without causing them more pain. So work on your extractions, watch videos, watch your mentor, time yourself, and make sure that you can get through extractions as efficiently as possible, okay? Use of routing sheets to reactivate patients and create a busy office. The use of routing sheets is so important. I initially was hesitant to use routing sheets because I wanted everything to be electronic. But when I found out that there's so many different touch points to the patient with that routing sheet that it just created an amazing patient experience, I started to fall in love with routing sheets to the point that it's required. Think about the full cycle of a routing sheet. The routing sheet lets us know without walking into the waiting room what our waiting room looks like. The routing sheet allows us to walk into an operatory and know what the patient's name is without having to pull up the chart. The routing sheet allows us in a half a second to see if the patient has their preventative appointment or not. So if we go to our routing sheet portion of our doctor manual, we can see that when this next preventative appointment is not there, we can schedule that patient for their next cleaning and really train assistants to have that next cleaning scheduled before we even walk in the operatory. This little block right here on the routing sheet has reactivated literally tens of thousands of patients and created long-term patients or gotten episodic patients back onto a regular preventative schedule. And then the ability of us to write down information that happens in the procedure to be communicated to the front. For example, this patient owes $500, but they're going to only pay $250 today. Imagine a patient goes up and instead of, let's say that he's there with his girlfriend and he's, telling his girlfriend that he's super rich, and we did a $500 procedure and he had agreed back in the clinic to only do $250 today. Well, he goes up to the front and we didn't use a routing sheet, and then the front says, oh, looks like it's $500 today. Then he has to have that uncomfortable conversation with the front that he only has $250. Even though he told his girlfriend that he has millions of dollars in his account, okay? The other thing too is as simple as the patient now walks up to the front, and instead of you having to say, or the front having to say, oh, and what was your name again? They could say, all right, Frank, so it looks like you owe $10 today. Just that little tiny interaction, just think about the difference between, and what was your name again? And for a person who came in and has been in the clinic for 2 hours and now we don't know their name versus now we know their name, there's just so many reasons to use the routing sheets, okay? Strict adherence to all scheduling protocols, especially confirmation calls. I go into so many practices where there's a high no-show rate and low productivity. Why? Because we're not doing confirmation calls. We have in the background of every single office or every single computer how the 4 confirmation statuses should be used, okay? There's training videos on it. Doctors need to understand that if it's past 4 weeks, that is unconfirmed. If it's less than 4 weeks, it is other. If it's less than 4 weeks and greater than 2 days, it's other. If it's less than 2 days, it is confirmed, okay? And then the same thing on the left message side. If it's past 4 weeks, it's unconfirmed. If it's less than 4 weeks and greater than 2 days, it's sent email. And if it's less than 2 days, it's left messages. No exceptions. So if you are not following those protocols, basically if you're not doing your checkoff list and following up on your front, you're going to have a lot of bogus appointments on your schedule on the hygiene portion especially, and you're going to have a high no-show rate, and you're just not going to be as productive as you should be. The same thing with the scheduling protocols. Watch the scheduling video. Be super adherent to that protocol so that you can make sure that your schedules are as packed as possible. And then the last thing here is to shadow consistently until you are better than your mentor. You need to go into your mentor and say, you know what? I'm going to work my butt off until I am better than you. I find it a little bit troublesome that doctors are willing to come out of dental school and go to a GPR or an AGD and spend literally thousands and thousands of hours and get paid very little to learn how to do a moderate amount of dentistry, where we give you a ton of mentors and a ton of opportunity to learn your craft. But we find doctors, they're like, oh, I can't find time to even do 12 hours worth of mentorship. You need to schedule right from the get-go the days that you are going to be in the office shadowing your mentor, and schedule that basically from the beginning of your career at Open and Affordable and say, hey, mentor, I will be in for these amount of hours on these days, and I've scheduled it and I'm putting it in my personal calendar so I don't have other things competing for my time. You are not going to be good at dentistry until you are as good or better than your mentor, and that should be your goal, is to be better than your mentor. Watch all of the videos, read through the manuals, shadow your mentor, shadow other doctors until you can do what they do and say what they say so that you can get the same results.